Did you know that women prefer circumcised penises over uncircumcised ones? Hello everyone, my name is Oleksandr Naumchuk and I am a practicing urologist surgeon. I'm glad to welcome you to the channel Urologist Naumchuk. Today I will talk about what circumcision is, as well as the advantages and disadvantages of circumcision, what circumcision techniques exist, their cost, and how you can actually get it done with me. There is such a condition in men called phimosis. This is a narrowing of the foreskin. There can be quite a few reasons for this. The glans penis hasn't been exposed since childhood. Diabetes mellitus, which leads to a narrowing of the foreskin. All of this results in the glans not being exposed, which in turn simply leads to either pain or the man being dissatisfied with the way it looks. Or sometimes a man just wants certain benefits that come with circumcision. So what are the actual benefits of circumcision? The first is a reduced risk of sexually transmitted infections. The second is a lower risk of contracting HIV infection. The third is a more aesthetic and attractive appearance of the penis. Fourth, it improves hygiene, because when the penis is circumcised and there is no foreskin, smegma simply does not accumulate. Smegma is the residue of urine. After a man goes to the bathroom, some urine still remains under the foreskin, which, without proper hygiene, later turns into that white curd-like substance you sometimes see in the mornings, or if you haven't showered for a long time. This is called smegma. In short, if you are circumcised, there won't be any smegma. There is a reduced risk of penile cancer, and the main advantage of circumcision is the increased duration of sexual intercourse. With the glans exposed, a calloused layer forms on the head of the penis, and as a result, intercourse lasts longer. But what are the downsides of circumcision? And of course, they do exist. The downsides of circumcision are that your sexual activity and sex are simply off limits for about 2 weeks until your stitches heal and the swelling goes down. What methods of circumcision exist and which methods do I usually use? The first is the classic method. It involves the patient being admitted to the hospital ward under spinal anesthesia. That's an injection in the back. You don't feel anything below the waist, but you can talk and hear. Using a scalpel and cauterization, we remove the foreskin and then place stitches on the foreskin area. You stay in the ward for about 3 to 4 hours, give or take, after which you are free to go home. But nowadays there are more advanced methods that I use. This is circumcision, using an individual circumcision device. You can Google it and see what it looks like. A custom circumciser is a device that is purchased for each patient based on their size. During hospitalization, we usually don't use spinal anesthesia. Instead, we perform the procedure under local anesthesia. The duration of circumcision with an individual circumcision device is about 10 to 15 minutes for the entire operation. And similarly, after 2 to 3 hours, you can easily go home without any issues. What are the advantages of the individual circumcision device? The main benefits are that there is no bleeding and significantly less swelling compared to the traditional method, where more swelling tends to occur. In both cases, whether using the first or the second method, sexual activity and intercourse are prohibited for 2 weeks. If necessary, we can provide special tablets to prevent morning erections so that this does not cause any discomfort. But overall, patients are generally satisfied with everything. And after about 2 weeks, if you had used the classic method, your stitches would simply dissolve on their own. Or in the case of the second method with the individual circumcision device, the clips just fall off by themselves and you can safely resume your sexual life. My dear subscriber, if you're interested in the circumcision procedure, if you want to do it, if you don't know where to get it done, or if you have any other questions about this topic, you can absolutely feel free to contact me for a consultation. The link will be in the description, and I will try to explain everything to you in simple and clear terms. And together we can arrange a date for you to come in and have this procedure done, because nowadays a large number of men over the age of 25 want to get circumcised, since they understand that there are certain benefits and pleasures to it. So if you have any questions, you can ask them in the comments. Leave a like, subscribe and hit the bell so you don't miss my latest or newest video. You can also check out my previous videos. There are ones about the duration of sexual intercourse, how to improve it, how to make it last longer, and which medications you can take. So in general, if you're interested, just subscribe, leave a like, hit the bell, and we'll keep going. Have a great evening, everyone. Bye-bye.